people, so today I'll be showing you how to prepare a CV for senior care assistant or healthcare assistant jobs in the UK for people with little or no experience in health, or for people with no background in health. What do I mean? For people with no educational qualification in health. Okay, so if you're interested, stay tuned. Stop that. Hi, so if you fall under this category, that is if you have little or no experience in health or nursing and you have no educational qualification in nursing or health and you want to come to the UK as a senior carer or as a healthcare assistant, I've already done a video where I showed you guys some of the things that you can do to increase your chances of getting this senior care assistant jobs or healthcare assistant jobs in the UK. I explained the details. So if you have not really watched that video, I would advise that you click off this video, go watch that video, and then when you're done, you come back, because I'll be referring to some of the things that I said in that video, and if you go ahead and watch this video, you might not really understand. You get me? In this video today, I'll be giving you some tips when you're writing your CV, and then we're going to go through the whole structure and format of CV writing for people in this category, and then at the end of the day, I'll give you some advice and I'll show you a CV that I have done purposely for this video. You understand? So if you're watching this video, I believe you already know what a CV is. A CV is just a document, right, that helps you market yourself for a job. Okay, so just a piece of document that tells a prospective employer everything they need to know about you so that it can land you an interview and hopefully get you the job. So on a CV, you're basically selling yourself, marketing yourself. You understand? Now let me talk about some tips when you're writing your CV, and then we'll go ahead to the structure and format for people in this category. So even if you have 10 years experience, guys, please limit your CV to 2 pages. When I say 2 pages, I mean 2 A4 size pages, nothing longer than that. What you don't understand is that the recruiters or the prospective employer, they probably have hundreds, if not thousands of other CVs to go through. So if you come with 5-10 pages, it's going to turn them off, honestly. So make it brief, concise, and straight to the point as much as possible. Make sure the first page is the power page of your CV. Let all the very impressive things be on the first page, and most importantly, the top quarter of the first page. Okay, when they get your CV, they're going to skim through the CV and let the first parts that they go through impress them the most, so that when it hooks them, they are likely to read the rest of the CV. But when there's nothing impressive on the top quarter of the CV, it can actually turn them off. So the very impressive things should be on the first page, and if possible, the top quarter of your CV. So especially for people in this category, as we go through the structure and the format, you're going to understand into detail what exactly I mean. Also, when it comes to the font style, Arial or Calibri is okay. Just simple font styles. No cursives, no special effects, nothing. Just use simple fonts like Calibri or Arial. Okay. And then the font size, usually 12 points is enough, or 14. But the headings of the different divisions or sections can be larger. You understand? Check your grammar and check your spelling. You want to prove to the employer that you are compassionate, but you spell compassionate wrong. Are you really compassionate if you can't even spell compassion? You understand? So check the spellings of the words, check the grammar, the tenses you are using. Another thing is to use a professional email. Okay, I know that probably you have an email called slayqueen@yahoo.co.uk or Niger Fine Babe or God's Favorite Child. Like, it should be a professional looking email. Simply put your name and at gmail.com, or your name and at yahoo.com. Something very simple. So if you don't have a professional looking email, please create one. It doesn't take a long time. Just create a professional email for your CVs. Another thing is to say the things you want to say in bullet points. Okay, bullet points makes it easy to read and it makes it so clear and so nice. But if you write everything together like an essay, it's going to be very difficult to read. So put all your points in bullet points. One thing that people fail to do is also they fail to create a CV for each job they're applying for. Guys, your CV for each job application should be different. You should always tailor your CV to meet the requirements of the particular job you're applying for. If you're applying for a domiciliary care worker, it should be different to meet the requirements of a domiciliary care worker. And if you're applying for a live-in carer, that as well should be different to meet exactly what the recruiter is looking for. You understand? I will explain this into detail as we go forward. So always tailor your CV to meet the requirements of that particular job you're applying for at that point in time. It's very wrong to use one CV for all your job applications. Always do your research, okay, and then check the the exact requirements that the employer needs and tailor your words to meet that. I'll talk about that into more detail later. So let's talk about the structure of the CV. So obviously your name and your contact details aspect, and then there's a professional summary part where you tell them why you're looking for the job, and then something little about your career so far. There's a skills section as well, and then you can talk about your career summary or your work experience or your work history, and then your educational history, and then you can talk about the certificates or awards you have received. If necessary, if you think this will also help the application, you can add your hobbies or your interests. So I'm going to talk about each of these sections that I have already mentioned, and then I'll tell you what you should do for people like you that have little or no experience in health, no health background. But I created a CV purposely for this video, so I'm going to take you through. So let's start with the contact details. So obviously the contact details, it doesn't change whether you have a background in health or not, just your contact details. You can see my name, Lionel Griselda NT, and my address, and then my number, and then my email address. Okay, I didn't add my country school, but don't forget to add yours. And then the professional summary. So with a professional summary, is usually just a paragraph or some few lines telling the recruiter or the employer why you think you are suitable for that job. It's something that should be really catchy. It should hook them so that they are likely to read the rest of the CV. It should be something that you should actually take your time to write. Don't overload that part with so many CV cliches. Okay, hardworking, team player, all those things are CV cliches. Almost everybody uses them. Limits them. I'm not saying they are not important, but don't overload this part with CV cliches. Make it something that is very, very impressive. Okay? So if you have no experience and you're just school graduate, at that part you can talk about the course you did, especially if the course is a health related course, because this CV we are writing now is for a care assistant job. So if let's say you did some health related course in school and you had just graduated, you can briefly talk about it over there. And then if let's say you had first class or something, you can make mention of it over there as well. You understand? And if you watch that video, I mentioned that you're supposed to do some voluntary work as well to get some experience. You can mention it there as well. So let them know you are fully trained and you have the necessary skills for the job. And that part should be very, very impressive. If you're a fresh graduate from school and then you had, let's say, distinction or first class, you can make mention of that. If you started volunteering and then you're gaining a lot of skills, you can make mention of that. If you have done the 15K certificate courses, you can briefly mention that there as well. It's something that is relevant to the job you're applying for, that is very catchy, that can hook your recruiter's interest for them to go through the rest of the CV. So it shouldn't be boring at all. It should be very, very interesting. For the purpose of this video, I put something together. Let's read it. I'm a diligent healthcare team member with skills and training to safely support patients and assist other team members. Always ready to help with hygiene, mobility, and cleaning needs. Work fast to stay ahead of continuous patient workload. Delivers attentive and compassionate care, and fully trained in the 15 care certificate courses. As much as possible, invest your time into that part to make it very catchy. Make mention of very, very impressive things that you have done. Let's say when you were volunteering, you were in charge of 30 patients. Make mention of that. Let's say you volunteered for 1 year or 2 years in a care home or in a hospital. Make mention of that. With 2 years experience in care as a volunteer care assistant, you let them know that you are skilled and you have the knowledge. This part is very, very important because it forms part of the top quarter of the CV and it's definitely on the first page of the CV. Another tip is that when you're writing your CV, we have soft skills and we have hard skills. Okay, soft skills are skills like team player, a good communicator, compassionate, confident. Those are soft skills. We can't really measure them properly. And we have hard skills. Hard skills are let's say you're skilled in medication administration, you have IT skills, and all those things are you can actually do, not all those abstract things. These are things that we can actually watch you do. You understand? Soft skills are important, hard skills are important, but as much as possible, always make sure that the hard skills you use in your CV or in the skills section, the hard skills are more than the soft skills, okay? Don't overload your CV with soft skills only. So now let's talk about the skills. When you're looking for a care assistant job or senior care assistant jobs, there are some skills that they may need you to have. And if you volunteered, like I advised, you will definitely learn some of these skills and you can put them on your CV. So let me take you through some of the skills that you can put there as your core skills for care assistant or senior care assistant jobs. Some of the skills include personal care, meal preparation, housekeeping, elderly care, basic life support, clinical waste disposal, pressure area care, stomach care, patient handling and positioning, safeguarding knowledge, medication administration. These are some of the skills that once you do the volunteer work, you can gain. I'm not saying write stomach care when you don't have stomach care experience or you don't have the skill of performing stomach care. You can exaggerate, but be honest. You understand? understand? So these are some of the skills. If you have these there, they are relevant to care jobs in the UK, so you can put some of these there. Now let's go to the next section. Now this is the very, very important part. There's your career summary or your work history or your work experience part, and there's the educational part. Now the part that should come first depends on your situation. If all you have done in this world is working as a civil engineer your whole life, please don't start with that. Don't start with your work history, because if that is all you have done, and remember the top quarter of the CV is very important, when they see that you have constructed, let's say 50 roads in the last 5 years, it's impressive, but not for a care job or not for an employer who wants you to come and take care of people. You understand? So that is irrelevant to the job that you're applying for. So do not start with your work history if that's all you have done. Please, you can start with your volunteer work when you start your work history. If you have volunteered as I advised, you can start with that. If you volunteered in a hospital, that is relevant to the job you're applying for. So that is what you're supposed to start with. So when they see that, oh, then they pass your CV to the next stage. Don't start with something that can turn them off. If you think it's your education that will sell you most for the job you're applying for, start with your education. Let's say you studied something in social care services or something, or let's say you did some form of a health related course. So that is a bit relevant to the job you're applying for. So you can start with your educational qualification. Or let's say you're a fresh graduate from school and then you did some form of health related courses. You can start with your education and follow up with your work history, where you can mention the internships or the volunteer jobs that you did that are health related. So please don't start with things that can put the recruiter off. So based on your situation, if you think it's the work history that is more relevant to the job you're applying for, start with the job history. And if you did volunteer work, you can start with that as well. And if you think it's your education that makes you more qualified or makes you a better candidate for the job you're applying for, start with your education. There's no specific rule that says that everybody should start with their work history or everybody should start with their educational background. Just start with the one that sells you most. And as much as possible, when you're listing your work history, you're going to go in reverse chronological order. What I mean is that you start with the most current ones first, okay? And then you continue like that, okay? Let's say at the moment you're volunteering in a hospital as I advised, which is very important. So you start with that. Let's say you started in January 2022 till date. So you write, let's say you're working as a volunteer care assistant from January 2022 to current, and then you mention the name of the facility you're working at. So let's say it's Kingsway Medical Center, Lagos, Nigeria. I'm going to mention some of the things that you did as a volunteer care assistant. This is where, if you did your research well, you should be able to know what exactly to write, okay? Every job vacancy or every job advert, they put there what you'll be doing in your new role when you come on board, or what you're expected to do, or the requirement or the job specification. So as much as possible, always go through the job adverts for that particular job that you're applying for and check the requirement, okay? So you can use some of their words for this part of your CV. So let me show you something. So I have my laptop here now. So now let's go to Google and let's go to carehomes.co.uk. I've mentioned this in several of my videos. It's a site where they mention all vacancies in care homes in the UK, okay? carehome.co.uk. So Google search. So this is it. All right. And now when we come here, we'll go to job search, okay? We'll go to job search, okay? This job search part. Let's go to job search. And then now we're looking for a particular role. We are searching for, let's say, care assistant or care support worker, and then you click search, okay? So these are all the current vacancies. There are several of them, but guys, not all of them are looking for international applicants. So I'm not saying that all of them are searching for international applicants, but I'm just using that as an example for this video. So let's go to care assistant in Bupa Care Homes, okay? So let's go to the details, okay? So when we get there, okay, they are saying that the job title is care assistant, the setting is a care home or a nursing home, you're going to be a carer or a care assistant or a care support worker, it's a full-time job, the salary is 10.35 or 11 to 11.35 per hour. That is not what I'm saying look out for. So let's say we want to apply for this job, okay, let's look out for what they mean, okay? They said you're going to be assisting residents with personal care duties such as bathing, dressing, and toileting. Okay, they are also saying that you're going to be supporting residents to move around the home. This might involve supporting them to walk, transferring them into a wheelchair, or using a hoist, repositioning residents to ensure they are comfortable and supported. And they're also saying that you're going to be doing admin duties like updating food, fluid, and stool charts, supplementary files, daily notes, and care plans. You're going to be supporting the nurse or the senior care assistant to complete monthly and weekly checks to monitor the health of the residents and reporting any significant changes. And then they said you're going to be serving meals or drinks and transferring residents to the dining room for those that will be doing day shifts. And then you're going to be attending planned activities, assisting the team, repositioning, providing care as necessary, and taking part in day trips outside the home for day shifts people. So now, guys, look at these things. Write them down. Write them down. Take a pen, take a paper, and write them down. You are going to use these same things that they are looking for in your CV. This is what we call tailoring your CV to meet the requirements of the employer. They definitely mentioned some keywords. If you notice, they mentioned things like personal care duties, supporting residents, updating food and fluid stool charts, serving meals and drinks. These are key things that they are expecting of you. So let them know that you can do those things already. So if you don't have any experience at all and you're volunteering, these are things that you definitely can do. So you can put them there in your CV. Give them back their own words. I'm not saying copy it ditto. Summarize it, but use the same keywords that they have used in your CV for them. That is why for every job, the CV should be edited a bit or updated to fit the particular requirement of that particular job that you're applying for. Let's go back. Okay, so there are several other things. There's, let's say, care assistant for this care home, Admiral's Reach Care Home, Chelmsford, Essex. Their requirements may be similar and they might also use particular keywords. That's why if you're applying for the first one, you have to use their keywords that they use. And then if you're applying for this Chelmsford one as well, you're supposed to view their details and check exactly what they are also looking for and use that in your CV. They are also saying that as a care assistant under the guidance of a registered nurse, you have to take responsibility for the physical and emotional well-being and social needs of our residents, assisting residents with personal care activities. So personal care repeats again here. Washing, personal hygiene, dressing, assisting with meals. So meals repeats here again. So you realize that these are things that are very important for the care job application. So these are things that you should include in your CV. But as much as possible, check the requirements for the particular job that you're applying for and tailor your words to meet that particular requirement for that particular job. If you volunteered, let's tailor our words to meet this particular one. I said that I worked as a volunteer care assistant from January 2022 to current, and I worked at Kingsway Medical Center at Lagos, Nigeria. And now I have to list down some of the things that I was doing there, okay? And like I said, bullet points, okay? So aided service users in everyday activities such as washing and dressing, ensuring constant safety and effective care. So you see that I have put back the washing and dressing and like some of the things that I saw there, you understand? Demonstrated consistent respect and privacy for care users. Remember, one of them said you'll be doing admin work. So if you check this one, I said charted daily observations, mobility, activity, and eating percentages to aid continued client assessment. So basically give them back their own word. And also when you're listing the things that you have done, try and use action verbs. We have things that we call action verbs. Use the ones that are relevant to nursing. Action verbs are like implemented, monitored, charted, observed. You know, those action verbs, they make your CV a bit more powerful. Now, after you've written the volunteer experience at the top part, the first thing is your volunteer experience in care, because that's the one that is most relevant to the job you're applying for. Now you have to list the other things that you have done. You can't say that in the whole world that you have come, the volunteer is only the thing that you have done. Now you have to list the other things that you have done, okay? Let's say you take care of your mommy's shop, your provision shop, or your grocery shop in front of your mommy's house. It is work experience. Never undermine any experience. Oh. Even if you were the housekeeper, there are some things that we call transferable skills that you can apply to the job that you're applying for. You were only a shop attendant. Don't be disappointed. Oh. Don't feel that because of that your chances have reduced. I'm telling you, there are so many things that you picked up as a shop attendant that you can use as a care worker in the UK. There are several things. So we call these things transferable skills. These things that were listed on the job sites that we just checked. Think about it. Which of the skills or the things that you did as a shop attendant can be transferred to working in a care home as a care worker? Think about it deeply. If you're not getting anything, let me show you what I wrote. So let's say you were a shop attendant from, let's say, February 2019 to January 2022 at Mama Bobo Ventures in Accra, Ghana. There are some skills that are transferable, that are still relevant, that will still be relevant to your job as a care worker in the UK. Let me list some of these skills. Fostered positive relationships with customers to enhance loyalty and retention. As a care worker, you need this as well. You're supposed to be able to foster relationships with your clients or your residents or your patients, and then enhance loyalty. You understand? So you can put this there. Don't go and write that you were able to do sales of 5,000 Ghana cedi every day selling Gary and whatever it is. It is good. It is impressive, but not relevant to the job you're applying for. So I know you did so many things as a shop attendant, but as much as possible, pick out the things you did as a shop attendant that are relevant to care work. You resolved customer complaints and process issues with proactive problem-solving skills. You covered extra shifts and maintained flexible schedule to achieve store goals. In the UK, they really like people that have flexible, schedules to be able to take extra shifts and all that. So when you put this there, that when you're working as a shop attendant, you're able to take an extra shift is a good plus for you. You improved customer retention by delivering tailored and genuine service. You listened to the customer needs and preferences to provide targeted advice, increasing sales opportunities. For nurses and care workers, they always say that you should always provide service that are targeted to the needs of the resident you are catering for. So this is the exact thing, but this time around for a shop attendant. This experience that you have can definitely be transferred when you're working as a care assistant in the UK. Do you understand where I'm going? Let's say you were working as a civil engineer October 2018 to February 2019 at Tema Construction. Let's say the location is Kitwe, Zambia. What kind of things were you doing as a civil engineer that can be applied to care job or care worker? Think about it. Think about the things that we looked at for the requirement and develop your own. So I wrote a few things down. You trained and managed, let's say, 50 junior engineers and contractors, because as a care worker, whenever there is a new resident or there's a new staff, you'll be asked to give them some form of training. Or let's say there's an agency worker who's only working there for a day. Training other workers or orienting other staff is also important. You can write that. You increase safety ratings. Safety is very important when you're caring for people. So that is also good. You increase safety ratings by identifying and resolving several structural issues. So you see, this can be applied. You prepared risk assessment. Guys, nursing and care work is all about risk assessment. Before you do anything, before you even take a resident from point A to point B, you're supposed to do a risk assessment to see that is the place safe? Is moving the resident necessary? Should I really do it? How should I do it? What equipment do I need? There's always risk assessment in care. So writing this, you are a civil engineer, but there are definitely skills that you have developed as a single engineer that can be applied to working as a carer. And those are the things that write in your CV. Don't go and write 50 roads that you constructed. They are very impressive. But how is that important to somebody that wants to employ you to come and work as a carer? It is not important. So do not write those ones. I wrote a few for receptionists as well. For receptionists, let's say you promoted health and safety compliance by monitoring whatever implementation. This is good. You resolved issues swiftly and efficiently in a friendly and supportive manner. You kept the reception area clean and neat to give visitors. So guys, every job that you did or that you are currently doing, there are some skills that you have that are transferable to care job. I'm advising you to do voluntary work. I've already done a video on how to write a letter to request to volunteer at a hospital or health facility. Check that video out. Write that letter, start the volunteer work. And when you're writing your work history, start with that one and then continue with the rest. But even with the rest, there are definitely skills that you have developed over time that you can transfer those skills when you're working as a carer. Write those ones. And now you come to your education. Education also, you work backwards. So for the most recent ones, then you work backwards. If you had a pass or you had a fail, do not write what you had there. But if you had first class or something that was quite impressive, let's say you were the valedictorian of your year group, you can put that. If you don't have anything impressive, just leave it like that. So I wrote BSc Social Science, studied some courses like history, law, etc. The month and the year that you graduated, KNUST Kumasi, Ghana, and then you graduated with, let's say, first class honors. And then also, if you watch that video, I mentioned that you're supposed to do the care certificate courses, so you can write your certifications and you can write care certificates, 15 standards, and then you can list them, equality, diversity. If you don't have space, if you're exceeding 2 pages, you can just leave them like that. And then people also write their hobbies and their interests, okay? So if your hobby or your interest is relevant to the job you're applying for, by all means write. If your hobby is swimming, it is not relevant to this. Do not write it. It is not. Do not write swimming. Leave that part out, okay? I also said that it's always advisable to add a cover letter to the CV. In my next video, I'm going to show you how to write a cover letter. And then guys, as much as possible, prepare a spreadsheet, okay? And then anytime you submit a CV to a particular facility, you write it down and you write a few details down. I have prepared something like that. Okay, so let's say you can prepare a spreadsheet and then you can write all the facilities that you have applied to. Let's say you applied to Oxford University Hospital. The date of application was, let's say, 10th March 2022. What role did you apply for? Let's say you applied for a role as a care worker, and then what was the submission deadline? Sometimes they will write the submission deadline and then you write the contact details. What email did they ask you to send it to? You can write it there, and if there was a number as well, you can write it there. And then you can give yourself a date that you want to follow up. It's always advisable that if you're not hearing from them, just do a follow up and check what's happening, check the status of your application. So always make sure that the follow up date is after the submission deadline. Let's say you see a job now and then the submission deadline is in 3 weeks. Don't go and follow up before the submission deadline. They have not finished collating all the applications. So wait till after the submission deadline and then you can send a follow up email that you're checking the status of your application. In my next video, I'm going to show you how to write a cover letter. Sorry that this video has been so long, but as much as possible, I needed to cover every single thing. Please subscribe to the channel. If you don't subscribe after I have taken my time to do this, then you just know that you're a criminal. I hope that you find value in this. I hope that this helps you to get a job. When you use these things and then you get a job, give me feedback, okay? And I'll really appreciate it. So guys, thank you so much. Subscribe to the channel and like this video. I love you guys. Bye.